So I'm going to pause there and turn it over to Dr. Randolph for some additional comments, then we'll open it up for questions.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, Health Officer. Just want to highlight a few points, have a slight conversation. One is that per the health directive, we are allowing pretty much all businesses and services to operate in accordance with the safety measures outlined in the Health Directive number 14. These services and businesses are asked to submit a plan to show how they intend to operate, and if indeed the plan is approved, they are able to operate according to the Health Directive. In it, and as a result of this, enforcement of wearing masks and 6 feet social distancing would be highly emphasized, to the point where our position would be, you demonstrate the ability that you can operate safely under the Health Directive. And if we find that you are in violation, we get complaints or we get reports or outbreaks in your particular establishment or facility, we will investigate and subsequently eventually close for a minimum of 2 weeks if you're in violation. And so you're able to operate, but you must do according to the Health Directive and adhere to the safety measures in the Health Directive, particularly the wearing of the face mask and face covering. And this is very important in light of even the most recent news coming out of the CDC, that wearing the face mask does not only control the source, control the amount of respiratory droplets, you spreading the virus to someone and you not even know that you're infected, but it appears that even wearing the face mask protects you from inhaling as much virus as you would if you didn't have it. So you're protecting others as well as yourself by wearing the face mask. So we really want to emphasize that in addition to the separation, social distancing, the avoidance of crowds will be very important, as Dr. Haushalter alluded to, especially in the holiday seasons. We know the tradition, we tend to gather at grandma's house and then go visit aunts and go visit others to see what all is on the table for that day, and we'll encourage you not to do so. Primarily celebrate within your household. Even when you gather, try to gather outside if the weather permits, wear your face covering and be separated. Dr. Haushalter mentioned that our current rate is roughly 36 per 100,000. Let me just sort of break that down to you so you can see what that really means. Given the population of Shelby County is over 900,000, that means that at a rate of 36 people per 100,000, we could have an estimate of approximately 33,000 people who may be infected in Shelby County, which amounts to about 3.5% of the population. Well, what does that really mean? That means that if you're in a building among a crowd of 100 people, that means that 3 or 4 of them could be infected with the virus that causes COVID-19. So that's why you don't want to be crowded. That's why you want to be in a well-ventilated area, and you want to wear your mask. I want to just echo also the importance again, if you're sick or have symptoms, stay home. We're finding that a lot of our cases are occurring from people who having symptoms, but they still feel the need to go to work, or to attend school, or to go to a restaurant, or to socialize. These are the major activities that seems to be contributing to the spread of the virus here in Shelby County. So if you're sick, stay home. You have symptoms, stay home. If you know that you've been around someone who has been diagnosed with COVID-19, stay home. Go get tested. We have various sites, a lot of capacity. In some places, utilization is 35 to 50%, and so use what we have available in terms of checking yourselves out if you're in doubt of whether or not you are infected. And again, as I've said before, just because things are open and legally open, are allowed to operate, does not mean that it is medically wise for you to participate or to attend. You need to assess your situation and take the appropriate measures to protect yourself. Last thing is to urge you to get your flu shot. If you haven't gotten one, get your flu shot. With that, I will open up for questions.